Good morning, good afternoon, good evening to everyone. Sorry for delay. I know that there is 1 year, but that's okay because I know it's very difficult to know the time of each country in the whole world. It's very difficult, this job of Dr. Saji and your team. I would like to congratulate all your team and the 200 days of celebration of IFPH. And I would like to invite me to represent Brazil. I'm representing Brazil, but my face is Chinese. I was born in Taiwan, but since 51 years, I'm living in Brazil. And I have 6 specialties. My first specialty is infectious disease. And my last specialty is homeopathy. And today I would like to present 5 case reports. The first one is one video presentation of a patient from the homeopathy pediatrician doctor from Ribeirão Preto, is a city far from mine, 100 kilometers. And more 4 case presentation of my patients, all using homeopathy and Chinese tools in their treatment of most varied pathologies. And the first presentation I will begin to now is a patient that is a child that has chronic sinusitis, and his father that has obesity and was treated only with homeopathy. And we will present now his video presentation. Ok, Larissa, pode começar. Não dá para ouvir. Vou fechar. Pronto, Larissa. Hi, now I will do the translation of what he said in Portuguese. Portuguese is the first language in Brazil. I know that there are countries that can speak in Portuguese, such as in Portugal and Mozambique, and also some countries, but the majority of the countries speak in English. And the first case is his son, is an 8-year-old son that has chronic sinusitis. sinusitis, and he was treating with normal antibiotics treatment for a long time, and he didn't have any results with this kind of treatment using antibiotics, and that's why he began to treat with homeopathy medications, and since then he never had more sinusitis symptoms after beginning the homeopathy treatment. Even in the many cold days when his friends usually got cold or flu-like symptoms, he never had this kind of upper respiratory tract infection symptoms, and that is why he recommends the use of homeopathy. And also he, as his father, he has 39 years old. He was suffering from obesity, and he was in the beginning 120 kilos. In the beginning, he was suffering from anxiety, and he had much anxiety even to eat the lunch. He needed to eat 3 times the lunch because of his anxiety. Use case, and after I will.
Ma'am, your audio is muted, ma'am. Please unmute yourself. Yes, ma'am. Now you can speak.
Sorry, we are having some problems with the transmission. Sorry. Fala, Nadma. Fala, Nadma.
Vou falar.
Isso.
Boa tarde. Vocês estão me ouvindo?
Estamos.
Estão me vendo?
Sim.
Queria cumprimentar todos os profissionais que participam desse congresso. Você vai traduzindo? Ou
Não, você vai falar tudo.
Ah, tá. E queria me apresentar. Meu nome é Nadma. Eu sou dentista, moro em Franca, estado de São Paulo, Brasil. E comecei o tratamento com a doutora Wei, e bendita a hora que eu achei essa grande profissional daqui de Franca. Ela é muito respeitada aqui no grupo que ela faz parte, que é a Unimed. E eu vou contar a minha história resumindo. Eu fui fazer um exame de rotina ginecológico com o meu ginecologista. E ele pediu um exame de tireoide, que não era comum, eu não tinha. E fui fazer para desencargo. E quando veio o resultado, veio um resultado que eu tinha um tumor, que era para eu checar e ver direito que tumor que era. Então, foi direcionado para biópsia, punção, e foi constatado um tumor do grau 4, de 13,8 e o outro 12,6 centímetros. Então, um tumor considerável, maligno. Então, o profissional que me encaminhou para um otorrino para fazer a cirurgia, e aí eu já tratava com a doutora Wei. Quando a doutora Wei ficou sabendo disso, ela falou: Nádia, você não vai operar. E isso, o outro profissional já tinha feito toda a documentação, o anestesista, tudo programado. E aí a doutora Wei falou para mim isso 3 meses e meio antes da cirurgia, da data marcada. Então, ela fez uma proposta para mim. Nádia, você poderia vir todos os dias aqui? Porque ela faz homeopatia com a gente, comigo, com o filho meu. Toda a minha família trata com ela. E ela propôs o seguinte: você tomaria todos os remédios da homeopatia e eu faria acupuntura em você. E depois a gente vê antes de você operar. Então, eu aceitei, eu ia todos os dias no consultório dela, como fui, e às vezes, 2 vezes por dia, tomava 5 frascos a cada, assim, mais ou menos um mês e meio, e ela me dava 5 frascos da homeopatia. E eu tomei, depois de 4 meses, estava marcada a minha cirurgia. Antes de eu fazer a cirurgia, ela falou para mim: Nádia, você vai fazer uma ressonância para ver o tamanho dos tumores. E eu falei com o meu médico, ele falou: não adianta, você vai ter que operar mesmo, não existe milagre. E eu posso falar para vocês que eu sou um milagre, na mão da doutora Wei, com a ajuda de Deus e depois dela. Então, eu gostaria de se frisar para vocês que quando eu fui fazer, antes de operar, que eu fiz a ressonância, a punção e a biópsia, o tumor estava de 3,8 e o outro 2,6. Regrediu muito e ela falou comigo: você não vai operar. Você arruma uma desculpa, fala com o profissional, mas eu não podia fazer isso porque já estava agendado até anestesista. Então, eu fui fazer cirurgia. E ela me acompanhando e eu tomando toda a homeopatia que ela passava para mim. E que eu sempre acreditei muito. E aí, quando eu saí da mesa de cirurgia, o médico, foi falar com uma irmã e com um filho meu que estavam me aguardando. Então, ele usou esse termo: eu não sei o que aconteceu, mas os 2 tumores da Nádia regredido, coisa que não é comum acontecer. Então, ele ainda falou assim, se ela tem alguma religião, alguma crença, ela se apega a isso porque funcionou muito. Eu falei, aí eu estava assim, no centro cirúrgico, na recuperação. Quando eu fui para o quarto, ele foi me ver, ele falou, Nádia, eu não sei o que aconteceu. Então, eu chorei muito, fiquei muito emocionada, muito grata à doutora Wei de ter me dado essa oportunidade, de Deus também me fazer esse presente, né? E posso falar para vocês, quando ele fez a proposta para mim da cirurgia, ele avisou, você vai fazer quimioterapia, você vai fazer iodoterapia, e sem muita perspectiva de melhora. Então, graças a Deus, quando ele fez o segundo exame depois da cirurgia, ele falou, Nádia, você não vai precisar nem de quimioterapia, nem de rádio, nem de iodoterapia. A única coisa que eu tomo é o Puran T4 e todos os remedinhos, os cristais da doutora Wei, eu tomo e do jeitinho que ela pede para tomar. Então, eu sou muito grata a ela, reconheço o valor profissional dela. É difícil conseguir hora com essa moça, que ela tem um valor absurdo. E é muito, assim, entendida do que ela faz, e ela passa muita segurança para a gente. Quando ela fala, ela é de pouco falar, mas o que ela fala, se doeu ou não, ela fala, te alerta e acontece o melhor para a gente. Então, eu posso falar que a homeopatia me ajudou e tem me ajudado muito. Eu gostaria de agradecer essa oportunidade que a doutora Wei me deu de expor o meu caso, porque para mim é muito importante eu falar que eu não tinha perspectiva de vida, estava assim, totalmente descrente, e a alegria de viver voltou com tudo. Viu? Eu sou muito grata à senhora, viu, doutora Wei?
Obrigada, Nadma, pela sua descrição, tá? Agora eu vou fazer a tradução. Now I will translate what she told about her case. She is a 70-year-old woman. She is a dentist, and she did a diagnosis of malignant thyroid tumor 2 years ago in 2018. And the doctor, the head and neck doctor, did a surgery 3 months after the diagnosis. But between the diagnosis and the surgery, she went to my clinic to do acupuncture, and I did the measurement of her chakras energy centers that were all in the lowest level of energy. That is why I use the homeopathy medication to replenish these chakras energy that, according to traditional Chinese medicine, the reason for the development of the tumor is the lack of energy, information of internal heat. And that is why I give that medication. The homeopathy is not according to Hahnemann, but according to traditional Chinese medicine reasoning, to give her the energy that was the cause of the formation of a tumor, according to TCM. And that is why she began to replenish, to intake the homeopathy medications. I did 5 bottles of homeopathy, 1 each day for 5 days, for a month, or for 1 month, for each 2 months, to improve her energy. And she did the acupuncture sessions and Chinese dietary counseling. And at the surgery, 3 months after this procedure, she went to the surgery, and the surgeon did the biopsy during the operation. And what he found in the surgery was that the malignant tumor turned benign tumor. It was not malignant anymore. And the tumor that was 14 centimeters reduced to 3 centimeters. And that's why she's very thankful for the treatment that we did on her, because her doctor said that he was very surprised with these results, but because he was the treatment that she needed to have after surgery was to have chemotherapy or radiotherapy and use the iodotherapy too, and no more treatment with these kind of tools need to be done after he discovered that the tumor became benign. Okay, and now I will finish her case. This is a very rare case because I did a talk with many cancer doctors, even in many countries, that treat this kind of pathology, and no doctor, nurse, surgeon that works with oncology, they have this kind of result that one malignant tumor can turn benign tumor, only using energy treatment and not using Western tools treatment. I am very thankful for the case that this is my first case that I can treat malignant tumor that turned benign. And this is one of the doors that we are opening to other cancer patients that we can treat cancer using only energy tools, using homeopathy medications. And this theory that I use is a theory that I create entitled Constitutional Homeopathy of the 5 Elements based on traditional Chinese medicine, that I will show you at the end of my presentation. Now I will begin the second case. Third case is, her name is called Paulania. She is a diabetic patient, and she will give her case report now. And after, she will speak in Portuguese, and after her speech, I will translate in English again. Thank you.
Olá, doutora.
Olá, Paulania. Tudo bom?
Tudo bem? Tudo bem.
Pode começar. Coloca o seu vídeo, por favor. Pode falar,
boa tarde a todos. Meu nome é Paulânia, tenho 37 anos e estou aqui para falar um pouco sobre a diabetes. Na verdade, eu fui no consultório da doutora pela minha filha. E por causa disso, eu acabei contando um pouco da minha história para ela e ela começou o tratamento comigo. Então, eu tive 2 diabetes gestacional e nessa primeira diabetes gestacional que eu tive, eu não precisei tomar nenhum medicamento. Logo já logo já tive minha filha. Então, eu não acompanhei com nenhum médico. Na segunda, desde a gravidez, assim, desde o comecinho da gravidez, eu já comecei a tomar insulina, a NPH e a regular. Então, durante toda essa gravidez, a minha diabetes sempre foi muito alta. Então, foi a diabetes gestacional, assim, a mais perigosa, vamos dizer assim, pelos médicos. Quando eu ganhei minha filha, eu melhorei. Então, melhorei, achei que estava tudo bem. Depois de 5 anos, mais ou menos lá para 2015, eu tive uma pequena decepção. E atacou meu emocional completo. Então, como atacou meu emocional, parece que me deu um buraco dentro do peito, assim, e eu não sabia o que fazer. E aí eu comecei a sentir uma dor muito grande no meu pé esquerdo, e ele parecia que queimava, e fui ao cardiologista, fui no endócrino, marquei o endócrino também, e ele falou para mim, olha, eu acho que você está com diabetes. Eu falei, não, mas em 3 meses eu fiz o exame, não tenho nada. Ele falou, não, vamos fazer o destro? Eu falei, vamos. Quando ele fez, ele falou, minha filha do céu, você está com 600 de diabetes, você está entrando em coma diabético. Eu falei, como assim, doutor? Não posso estar, não. E aí ele falou assim, não, vamos começar o tratamento. Então eu comecei com as 2 insulinas de uma vez. Então eu tomava 20 unidades de uma vez. Então aquilo ali, para mim, foi indo. tomando aquilo ali, mas eu ainda não aceitava a diabetes. Eu não aceitava que eu estava diabética. E a minha filha, consequentemente, ela teve um problema. E a minha irmã, mas o meu cunhado falou, vamos lá, marca com a doutora Wei, que ela é muito boa, que ela é acupunturista, ela vai poder ajudar minha filha. E aí, quando eu cheguei lá, eu contei a história da minha filha e automaticamente contei a minha. Então, ela começou a me tratar. Então, antigamente, eu pesava 110 quilos. Eu cheguei a 54 quilos. Então, eu sentia muitas dores. E dessas dores, me deu neuropatia diabética. Com a acupuntura e com a homeopatia que eu estava tomando dela, recentemente eu fiz um exame e eu não tenho neuropatia diabética nas pernas mais, mas eu ainda continuo com a diabetes. Mas a minha diabetes de 550 a 350 que estava, hoje ela está 150, 160. E assim, eu estou muito feliz, porque é uma coisa que me ajudou muito, e com a alimentação que ela me passou também, sabe? Tanto a alimentação quanto a insulina, que eu ainda continuo tomando, me ajudou a diminuir. Então, eu não tenho mais a neuropatia, mas eu ainda tenho a diabetes. Mas eu falo que eu ainda vou terminar com isso, porque eu não nasci com isso. E foi assim, eu criei isso através de um problema pessoal, emocional que eu tive, e que eu falo que eu vou acabar com isso tudo. E eu tenho que agradecer muito a doutora Wei, porque a minha filha desenvolveu muito, principalmente a inibição de falar, porque ela não falava com ninguém. Ela ama a senhora, ela ama de paixão. E ela também melhorou bastante. E se der tempo, eu ainda conto a história dela também.
Tá bom, Paulane, muito obrigada pelo seu relato. Agora eu vou fazer a tradução, tá?
Tá.
Now I will translate what her talk. She had three one boy and two girls, and the last two gestational, she had diabetes, gestational diabetes, and she had to intake the insulin and the medication for diabetes. And after she was he was very obese at that time, and she had the babies. She stayed 5 years in good health, but after this, she developed diabetes type 1 because she was feeling some numbness in the feet, and then she went to the endocrinologist, and he did his glucose and discovered that she was with a high glucose at that time, more than 600 milligrams per DL. And she began to intake the insulin at that time, 2 kinds of insulin, but they still very high, even using insulin. And when she went to my office, she went to take her daughter that has 8 years old, and if we have time, we will say about the history of her daughter that has chronic constipation. But after she began the treatment with Chinese dietary counseling, we changed all the dietary according to her energy disturbances, and we began to do the acupuncture and associated the homeopathy medications, but to replenish the chakras energy that was very, very low. All the chakras energy we measure through the radiesthesia procedure, and what we found that all her chakra were in the lowest level of energy. That is why we using homeopathy medication to replenish this energy. Her diabetes went down from 600 milligrams per DL to about 150 or 100 to 30 now, and she is very thankful for this treatment. But last year with the COVID-19 pandemic, she didn't go to the treatment, and now I don't know what is the situation of her energy, and she didn't went to see which kind of homeopathy did she need to intake, and that's why I think with this pandemic, all our patients are very uncontrolled because they are not doing their treatment very well. And that is why I think we will have time to say something about her daughter at the end. Now we will begin a case of one patient. He is beside me. He will be here. He will speak in Portuguese, and after I will translate in English to you to understand what he's saying. His case is about some fatigue symptoms after COVID-19 infection treatment. Okay, thank you. Vem cá.
Boa tarde. Meu nome é Sérgio Augusto. Eu trato com a doutora Wei aproximadamente há 18 anos, pois tenho um problema renal crônico, Berger, e já tive outros, hipertensão nesse tempo todo. Já fiz uma cirurgia de próstata, então ao longo desses 18 anos eu trato com ela. Agora, em setembro de 2020, eu peguei a Covid. Procurei um infectologista, onde fui tratado com ivermectina, com azitromicina e também com corticoide. Logo depois dos 15 dias de quarentena, mais exatamente 20 dias, voltei ao trabalho. E o que me aconteceu é que no período da manhã eu estava bem, no período da tarde eu tinha uma fraqueza enorme, uma fraqueza que não me deixava raciocinar nem trabalhar bem, plenamente. Procurei a doutora Wei e ela fez uma associação de homeopatia com acupuntura e 5 doses únicas diárias, uma cada dia. E no terceiro dia eu já não apresentava mais essas consequências do coronavírus. É isso que eu tinha que relatar.
Você ainda fala dos outros problemas que você tem além da hipertensão?
Tenho também, tem sido controlado a hipertensão através desses medicamentos, que ela sempre associa com a homeopatia. Tomo também medicamento como o Diovan, mas ela é associada, ela me associa sempre, porque faço uso constante da homeopatia, que ela me prescreveu. Tomo também Indapem, mas tudo isso e também o controle alimentar que ela sempre me prescreve. Se tiver alguma pergunta a respeito, estou aqui para tal. Muito obrigado.
Okay, thank you, Sergio. Now I will translate what he said. He's a 67-year-old patient. He's a dentist, and he is my dentist, okay? And he has some comorbidities. He has a chronic renal disease, Berger syndrome. Since adolescence, he has hypertension, and he has a dental implant since 2000. And 6 years ago, he had a prostate cancer too, and she did the surgery. And last year, in September 2020, she acquired COVID-19 infection, and he went to another infectious disease doctor that prescribed ivermectin, azithromycin, and corticosteroids in the beginning of this treatment, but he had no fatigue at that time. He had only low back pain and some fever after the beginning of the medication. He didn't have fever before the medication. and he didn't have any fatigue during the acute infection, but only he developed fatigue after 18 days of the infection, when he began to restart again to work in his clinic. And he told me that he was very tired, mainly in the afternoon. And that's why when I went to his clinic to treat my teeth, I prescribed him the homeopathic medication that he was intaking before the infection, but I think he didn't went to a very serious evolution, such as dyspnea, or had to be admitted in the hospital due to he was treating his deficiencies, because I did his chakras energy measurement 2 years ago, and they were in the lowest level of energy after his cancer surgery. And that's why since 2 years ago, he was treating his deficiencies, and that's why he had a very low, not very hard symptoms of COVID-19 that need to be admitted. And that is why after this treatment with antibiotics, I explained in my presentation on Wednesday, on March 17, on Wednesday, why homeopathy is the best medication to prevention and treatment of COVID-19. Because the majority of the patients that I'm treating nowadays is not, 97% of them don't have energy in their chakras energy centers. And this is not including only my patients. I think this is the patients in the whole world, because this could be the influence of the electromagnetic waves that is in the whole world, in every house, in every place that we are going. And this could be harming our vital energy and our prana, our chi in Chinese medicine, and that is why our immune system is very low nowadays, and that's why it's affecting children, it's affecting young adults, it's affecting every patients, and that is why we need to treat our chakras now to prevent not COVID-19, but always to prevention of cancer, diabetes formation, any chronic disease is caused by this lack of energy nowadays. And even if we are treating the symptoms, we need to treat the root that are the energy deficiency in the chakras. This is very important nowadays, because our world is not the same like 50 years ago, or 100 years ago, or 200 years ago. Now our world is moved by Wi-Fi and electromagnetic waves. We are now doing this meeting, the whole world is listening to me because we have Wi-Fi, but there is side effects of it. We are receiving some electromagnetic waves that are harming our energy, and that's why we need the computer, we need the cell phone, but we need to treat our energy too. Okay, and I think we have more time. I will invite Paulania now to say about her daughter, that her name is Julia. Paulania will say again the history of her daughter. Is called Julia, that had chronic constipation, and what we did in her treatment. Pode começar, Paulania, falando sobre a Júlia.
Bom, a Júlia, ela começou o tratamento com a doutora há 2 anos atrás. E quando a gente descobriu o probleminha que ela estava, eu corri na doutora. Ela tem um problema no intestino. O canal do intestino dela enlargueceu. Através de um exame que nós fizemos, e o médico disse que é um intestino adulto. Então, ali, as fezes que iriam passando por ali, elas paravam, elas não iam, elas não passavam, elas só ficavam paradas. Então, a gastro pediu para passar para o cirurgião. E o cirurgião queria colocar bolsinha nela. E eu não aceitava de jeito nenhum colocar bolsinha, porque eu achava assim, minha filha já é quietinha demais. Então, se ela colocasse a bolsinha, ela já ia ficar com muita vergonha. Então, ela não ia querer de jeito nenhum ir para a escola, nem sair para fora de casa. E ela já nem falava direito também, ela ficava sempre quieta, sempre calada. Quando eu comecei na Dr. Wei, que a Dr. Wei começou a fazer acupuntura nela, conversar com ela começou a se desinibir. Então, a gente sempre estava conversando e todos os exames que iria fazendo, o médico falava, olha, ela vai ter que colocar bolsinha. Toda vez eu falava para o doutor, eu não quero que coloque a bolsinha nela, não vai acontecer. E a doutora falava, não, pode ficar tranquila que ela não vai precisar fazer cirurgia. E graças a Deus, ela não precisou fazer cirurgia, ela já consegue ir ao banheiro, ela já consegue fazer as necessidades dela, de vez em quando escapole, mas ainda a outra médica disse que ainda vai ser normal, porque é um processo, como se começasse igual um bebê. Então, é um processo que ela tem que ir indo fazendo. Até tenho que voltar na doutora, pelo fato de que, por causa dessa Covid, quarentena, nem o outro médico está atendendo ela por medo dela pegar uma bactéria, uma infecção ou qualquer coisa assim. Então, na hora que passar, eu estou voltando, viu, doutora? Mas, graças a Deus, ela está ótima, ela está indo no banheiro. Esses dias que ela deu uma dorzinha, mas eu acho que é a ansiedade de ir à escola e parar, de ir à escola e parar. Então, eu acho que é um pouquinho da ansiedade dela. Mas agora, graças a Deus, está normal.
Mas o que você falou que ela tomou as homeopatias? Como que ela fez? Como que estava a medição dos chakras?
Ela começou a tomar as homeopatias da doutora e com isso ela às vezes ela danava comigo, mãe, tem que fazer igual a doutora está falando, no caso da alimentação. Então eu tive que mudar toda a alimentação dela, consequentemente mudei a minha também para poder nos ajudar, e com a homeopatia, onde foi ajudando a fazer aquele processo, acho que dentro dela. Porque aí foi acalmando, ela foi se desinibindo. Então, hoje ela conversa, hoje ela tem a agilidade das coisas, que antes ela não fazia nada, morrendo de medo. Então, já tirou até o medo dela. E assim, eu estou muito feliz pelo fato dela estar bem, porque o propósito era esse, deixar minha filha bem, e com a ajuda da homeopatia e da doutora, foi a melhor coisa que aconteceu.
Obrigada, Paulânia, pelo relato. Now I will translate what she talked about the case of her daughter. Her daughter is called Julia. Julia has 8 years old. She has chronic intestinal constipation since 2 years ago, and she was going to the pediatric surgery doctor, and he was thinking to do the colostomy and to deviate her, because she didn't go she didn't have daily bowel movement. She has only bowel movement every 7 or 10 days, and her abdomen was very bloated, because she didn't go to do pool in the bathroom. And after this treatment with the Chinese dietary concept, because in Chinese medicine, the constipation is caused by blood deficiency. And that's why we needed to change her dietary aspect to absorb adequately her nutrients. That was very wrong. She usually drinks dairy products, cold water, raw food, and fried foods. And that's why we need to change all these kinds of food that could induce the energy imbalances of her case. And that is why when she began to do the dietary changes and some auricular acupunctures, and I did the chakras measurement, and all her chakras were very deficient in energy. That is why she was not going to the bathroom every day, because she didn't have energy to move her intestine, the stools in the intestine, to out of her body. And that's why in the first days of the treatment, he went to the bathroom normally. And that is why now she is going normally to the bathroom, and she can do the stools every day. And that's why she is still treating her chakras energy deficiencies using homeopathy medications, according to the theory that I will show you, that I created, linking homeopathy with traditional Chinese medicine. Thank you, Paulania. Thank you, Julia. Thank you all my patients, and thank you for the patients that went to the video to show the case of you, the obesity and chronic sinusitis. Thank you, Sergio, here to be here to share your history. And I would like only to say to you, I will share some of my publications that all these cases are published at the internet. You can read their case and how I did the treatment using homeopathy. The first case is about the chronic respiratory infection. Okay, here. This is the case that has the publication about the case report of the treatment of cancer only using homeopathy and Chinese tools, improving the energy of the patients, because cancer patients usually have deficiencies in energy according to traditional Chinese medicine. And that's why when you use homeopathy medication, because homeopathy is a high diluted medication, according to Arne Schultz law, when you use high diluted medication, you can improve the organic process, you can improve the energy of the patient. And that is why when you use homeopathy medication, you can improve the energy that is lack normally in this kind of patients. And using this kind of treatment, you can treat the cancer itself without using any chemotherapy or radiotherapy. But this is one case, and the second case is a case of another patient. I asked her to come to give her case report, but she's working today because next week we are in lockdown and we cannot work. And that's why we are working the weekend because next week they want to have condition to work. And that's why I have other case report, because all cancer patients have deficiencies in energy. That's why we need to improve their energy and using only homeopathy, because other kinds of medication can harm even more the vital energy and worsening the energy condition and leading to worsening of the evolution of this, leading to complications such as development of metastases or other cancer formation in other sites. And the next publication that I can show you is the gestational diabetes. This is the case that the Paulania said about gestational diabetes. In this publication, we have 3 case reports. One is from Paulania.
Dr. Wheeling?
Yeah.
I think your time is over, 20 minutes over.
No.
Yes.
It's 3:30 to 4:30. I have 10 minutes.
Are you sure?
Yes.
Because it
yes.
is just a minute. Just
no.
a minute. Sorry, yeah. Sorry.
Yeah,
Let me see.
I have more 10 minutes, okay? It's
It is,
until 4:30. You said the Brazilian
it is
time
12
now.
o'clock to 1 o'clock.
Yeah. No,
One,
I begin 3:30
yeah,
to
yeah. Okay,
4:30.
okay. Yes. Continue. You have 9 more
Okay.
minutes remaining. Okay.
Yeah, okay. And
Yeah.
in this publication, I am showing that these patients are the diabetes patients that has gestational diabetes also have chakras energy deficiencies, and that's why when we use homeopathy to replenish this energy in the chakras using homeopathy, the diabetes will be treated, only rebalance these energies, because in traditional Chinese medicine, diabetes is formed by
Don't worry, my dear. You wait. You will have time until 5:30 in the morning. So I have time for you 30 minutes each, but you will have to wait. That's why
Dr.
I
Shaji,
wanted and I
please
followed your timing
unmute.
of 2:30.
Unmute your phone because you're speaking and I cannot speak. And in gestational diabetes, all the patients have chakras energy imbalances. That is why it's very important to treat all the women that before they get pregnancy, because some of them could have a gestational diabetes and the cause could be the chakras energy imbalances. And that is why it's very important in showing you that women in this case should be treated their energy only using homeopathy and not use insulin, because if you use insulin, you are not treating the cause. And the next publication in this case are this publication, there is about chronic respiratory infection. It's another about the first and second case report of a children that has chronic respiratory tract infection. Here we are demonstrating this article that children with chronic respiratory tract infection can be treated without using antibiotics. In this case, we use only dietary counseling, and the majority are using homeopathy medication, and a majority of them don't need the use of antibiotics, because antibiotics nowadays are harming the vital energy. And these children, I'm demonstrating in this publication that all of them also have chakras energy deficiencies. And if you treat their symptoms with homeopathy medication, it's better after the treatment you treated the chakras energy deficiencies to treat the lack of energy, the lack of Zen Qi. The Zen Qi is the vital energy that can protect the body against the invasion of the external pathogenic factor that are inducing the formation of respiratory tract infection. Then let me see, I have 6 minutes more. I have this publication is about the first case report. Is a patient with obesity that has anxiety. Why do patients still have anxiety symptoms despite the use of psychotropic medication? In this article, I'm demonstrating that anxiety patients also have chakras energy deficiencies, and that is why when we use this kind of medications, they will harm even more the lack of energy in the chakras energy centers, and that is why we need to reduce this kind of medication and replenish the chakras energy, or treat their anxiety with high diluted medication. That this patient said in his case that he lost 30 kilos after the treatment with homeopathy. And that's why if you treat the symptoms using homeopathy, it is very important to treat the root that are the chakras energy deficiencies too. And the other publication I will show, I have 5 more minutes, is this publication about chronic constipation. This is a case of Julia. It's, I think I put her case here, and there are more patients, showing what are the energy alterations and deficiency in the chakras leading to chronic constipation. And patients with chronic constipation, they have energy deficiencies too. That is why the body of the patient do not have energy to release this stool from the intestine. And that is why when you give homeopathy medication to them, you are giving energy to the chakras, you are giving energy to the meridians. And that is why the patient will have condition to release their stools. And this patient, that her mother said that she was very shy and she didn't wanted to talk. And the process of communication is commanded by the third chakra, that is the heart. And the heart meridian, this patient was very deficient in energy too. And that's why when we treat all the meridian, all the chakras that was deficient in energy, all her problems improve at the same time. Her communication, her shyness, she became more, her anxiety and all her emotional symptoms improve together with the chronic constipation symptoms. And she began to release this stool every day after this kind of treatment. And another publication, the last one, I think, is to show you. Oh, this is a case of my patient, of Sergio. This is another publication about the chakras energy deficiency as the cause of dyspnea post-COVID-19 treatment. But in this presentation of my patient, Sergio, he is my dentist, he don't have dyspnea, he had fatigue. And this publication is in the process of publishment, and this month will be ready. That's why I'm showing you this publication that is ready, and saying that the patient that have COVID-19, they usually don't have many symptoms, but with the treatment done with high diluted medications, such as the use of antibiotics, the azithromycin, hydroxychloroquine, or ivermectin, they are considered high concentrated medication. And according to Arnschult's law, that is a law created in 1888 by two German physicians, they are saying that the use of this medication can reduce even more the vital energy or the chi of the patient. And that's why I demonstrated in my presentation on March 17 that the majority of the patients that we have nowadays, include the COVID-19 patients, have chakras energy deficiencies. And that is why we need to treat only with homeopathy, improving the chakras energy, because the complications probably are because of the wrong kinds of medication, because of these patients' deficiencies in energy, that they cannot improve their symptoms because they don't have energy to fight against all the medications, all the problems.